Hey everyone, and welcome back to XO Medical Spa. Today we're going to go back to the basics, and one of the things we do so much of is lip fillers. So we're going to address some of the common things that people say when they get lip fillers, and what does it really mean when we have these concerns when we come back. One of the most common things people will do is when they come for their follow-up, or even just a couple days after fillers, they'll be like, look, my lips are uneven now. So the way we address this is, one, we always compare photos, before and after photos, to see, is it true that we have asymmetry? A couple things can happen. Either one, me as an injector, injected it and it became asymmetrical. Two, is your lips are already asymmetrical, and by enhancing it with volume, you see that asymmetry even more now. The other piece is, before you ever do aesthetics, how often are you staring at your lips? How often are you staring at your eyes? So now when you get lip fillers, you stare in the middle or in the mirror every moment, every day, selfieing, and you get more hyper aware and cognizant of all these little asymmetries. But typically what happens is we always have these asymmetries. One lip is longer, one lip is shorter, one lip is taller, one lip is lower. But until we start doing treatments into that area, we don't really notice it. Now with fillers or lip fillers in general, I always tell people it's a building process. We're gonna keep filling until we get to your happy place. Lips, more so than not, we have to fill probably every month, every 2 months, 2 to 3 times until you get to your happy place. Once we get to your happy place, then you usually don't treat it again within the year. Now, when I'm injecting, I do my best to watch for asymmetries. When I do the consult with you, I point out, hey, taller lip, lower lip, what are you trying to accomplish with your lips? So we always have that forefront conversation in regards to what you want to do. But let's just say I inject your lips unevenly. Lidocaine makes you swollen. Once we start injecting, it makes you swollen. If you have bruising and swelling, it makes you swollen as well. So it alters the way I see your lips when we're injecting. That's why I try to go so quick, is because if we go slow, your lips swell and it distorts what we see. So when you come back to me in 2 weeks, if you have that asymmetry and you didn't have that to begin with, when we compare before and after pictures, of course, we're gonna fix it up for you. So think of it as always a building process, especially with lip fillers. Now, let's just say your lips, perfectly symmetrical, which is no one, but your lips were perfectly symmetrical before I touched them. I inject your lips perfectly. Not saying I'm perfect, but let's just say we do everything perfect. 2 weeks, 3 weeks, 4 weeks down the line, the way you talk, the way you animate, the way you smile, the way you speak, the way you eat, we all favor one side of our face. We chew with one side of our face. When we animate, we smile bigger with one side. You can see the right side of my smile is bigger. So imagine if you had gel sitting on your lips, it starts getting pushed to the side of least resistance, or it starts getting pushed to where you're more animated. So I animate this way. Potentially lip filler might progress off to the side. We tell people don't use straws within the week, because if you use straws, that repetitive motion squeezes the filler towards the middle. So if everything else goes right, if everything else is perfect, and you come back in 2 weeks, it's asymmetrical, that might be another reason for it. It's just naturally how we animate and how we take care of our fillers post fillers. And probably the last one I'll address, there's a lot more when it comes to lip fillers, but another one I recently heard is, my lips don't look as good as my friends. My friends only get 1 syringe and they look beautiful. Me, I've already gotten 2 or 3 syringes and I still don't see my results compared to them. My first question is, where did they start? How long have they been doing fillers for? All those things play a role. So this client specifically, she had minimal to no lips whatsoever. So we put in 1 filler, she came back again, a couple months, put in another one, came back again, couple months, another one. But she still hasn't reached to where her friends were. So I asked her, where did your friends start? Did they already have full lips? And she says, yeah, they already had full lips. They've been doing this for how long? They've been doing it for years. Well, there you go. You're comparing full lips to your thin lips. You're comparing years and years and years worth of treatments versus yours. We've only been treating for a couple months. So we always compare ourselves to other people, Instagram, friends, models, but learn where you're starting from and where you want to get to. See where they started from and how long it took them to get there. So this one's a little more fun. This one's a little bit quicker. I know we talk about more complicated stuff. Last week I showed you almost how I fully do PDO threads. I had to keep a couple secrets for myself and how we do trainings. But lip fillers, always kind of the gateway when it comes to aesthetics. We do Botox, we do cheek fillers, we do lip fillers. But we always have these concerns post. So hopefully those address some of the concerns and some of the questions that people ask. we ask all the same questions. It's just we hear it every single day. When it happens to you guys don't hear the feedback every single day. So hopefully that helps in regards to some of the concerns you may have or some of the things you may run into post lip fillers, okay? So I hope you like this video. Again, please give it a thumbs up. Please, please, please hit subscribe. It really helps the algorithm. It really helps push all this education out. And all of you guys who have found me on YouTube and have consults and have done treatments is because of that algorithm that really pushes out this education of everyone else. And the sole reason we do this is really just to educate our clients. So if you enjoy it, please give it a thumbs up. I'll see you guys on the next episode of XL Medical Spa.